Hi everybody, I'm Dr. Bethany Powers here at Ward MD, and I'm going to talk to you today about rhinoplasty. So rhinoplasty means that we are going in and either changing the shape of the nose, or we're going in and changing the shape of the nose for your breathing. Oftentimes patients are coming in and they may have breathing issues. They feel like even at their baseline they're not breathing well through their nose. And this is outside of having a cold or being sick. When you come in and see us for a consult, we typically will look inside your nose, be able to determine if there's an issue. Oftentimes it's the septum, which is the area that divides the two sides of the nose, but oftentimes it can also be the cartilage on the surrounding areas of the nose or the outside part of the nose. We see a lot of patients that are in the category where they just want to breathe better through their nose, and they're a candidate for a rhinoplasty or a septoplasty, which means that we're going in and making a small incision between the two nostrils, lifting up the skin and changing the structure underneath with the cartilage and the bone in order to get you breathing better. If you're coming in and you're in the category where you want to breathe better, but you also would like to make some changes to your nose, we oftentimes have a lot of patients in that category as well. And we call those patients our combination rhinoplasty. So you're coming in because you want to breathe better, but we also are going to make some cosmetic changes while we're doing the surgery. And oftentimes I like to say form follows function. So we always want to make sure that we're establishing a great airway, making sure that you can breathe, but also making you look your best. So if you can't breathe through your nose and you come in for a consultation and we determine that you're a good candidate for a breathing functional rhinoplasty, insurance most often will cover that portion of your procedure. If you're also in the category where you're thinking about having that functional rhinoplasty for your breathing but also want to make those changes, then the cosmetic fee is just an additional fee on top of that functional rhinoplasty fee that's covered by your insurance. So what can you expect when you come in for a consult? We will see you, we'll look inside your nose. We'll also do a CT scan here as well as a camera exam inside the nose in order to look at the structures that are further back. At that time, we can determine if you're a great candidate for a septoplasty or if you were to need that rhinoplasty. Patients that are going through a rhinoplasty come in and they go home the same day. So we do our surgery here in the Ward MD Institute. So in the operating room, your rhinoplasty can take anywhere between 3 to 5 hours, really just depending on what work we need to do. Patients are also coming in sometimes talking about a revision rhinoplasty, and as you might imagine, that's going to be more complex. It's going to take a little bit longer. You go home that same day, but you're going to have a cast and you're also going to have some nasal packing on the inside of your nose as well as some splints. Patients are not breathing better. Oftentimes they're not breathing better for a good 1 month after surgery, and that's because number one, for that first week, you're going to have all of the splints in, and then number two, you're going to have a lot of swelling afterward. If you asked me and said, when are you really fully healed after a rhinoplasty? It's not until 1 year to 18 months out. So that means any tip changes that we make, any changes that we make over the dorsum of the nose really isn't going to show itself fully until all of that skin shrink wraps back down around the scaffolding that we've changed underneath. And that again is going to be about 1 year to 18 months afterward. In terms of post-operative care, we want patients to not use a swimming pool or go in the ocean or really do anything where you're submerging your face underwater for a good 6 weeks. And that's because that incision on the inside of the nose as well as the incision between the two nostrils is not watertight until that time. Patients oftentimes ask me as well, when can they go back to working out? When can they go back to kind of full physical activity? And full physical activity can be ramped up after about 2 weeks. For the first 2 weeks, we want you to lay low in order to diminish your risk of bleeding. Frequently asked question that we get asked is, when can patients sleep on their side or when can they sleep on their stomach? If you're a side sleeper or you're a stomach sleeper, I really want you to be sleeping on your back for a good 4 weeks after surgery. It's going to be different for every patient. Sometimes we have to re-break the bones for patients, and sometimes the bones are not rebroken, but either way, we don't want you to press a lot of pressure on that cartilage as you're healing up. When you come in for your preoperative appointment and your initial evaluation, we will morph your photos in order to show you and have a good conversation about your goals. And that's the main thing that we want to get at with that morphing, is that what are your goals and can we accomplish them in the operating room?